Hello. Today, I want to introduce you to someone that we've been partnering with during this current pandemic. This is Dr. Fathi. He is our consulting physician. He's been working with us through the COVID-19 pandemic and has been giving us a lot of great direction throughout. Welcome to the team, Dr. J.
Thank you.
Let's start by having you give us a little background about yourself.
Well, Tana, thanks very much. First of all, I am a family physician, and I'd like to start off by letting you know that my father needed memory care and was in the memory care unit at Merrill Gardens First Hill here in Seattle for 3 years. And when you're a family physician, you take it very seriously where you're going to send your parents and what sort of support you'd like them to have. And so I'm very familiar with Merrill Garden Services, and I'm very, very pleased with the operations that you run here. So I am a family physician. I worked at a community health center for 12 years doing full spectrum family medicine and taking care of folks of all ages, taking care of folks in the hospital and in clinics. I'm a clinical assistant professor at the University of Washington School of Medicine, and I was the senior medical director of a community health program at a large healthcare system here in Seattle for 4 years.
Okay, let's talk about masks. What makes masks so important?
Masks are extremely important. This disease, people catch it from basically breathing the same air of other people that have it. It's as simple as that. That's really a key way to think about it. We know that people wearing masks, it really restricts the distance that air vapors and particles, whether you can see them or not, are transmitted in front of you. So it's extremely important for people to wear a mask because you're not only protecting yourself, more importantly, you're protecting the people around you so they're not getting exposed to your germs.
I know the risk is lower outside versus inside. Why is that?
Social distancing is extremely important in the communities and outside the communities. We know that the spread of this disease will be drastically cut down by people avoiding crowds, and when you're around other people, staying at least 6 feet away. If you can't stay 6 feet away from people, you should wear a mask. But keeping that buffer zone around you it's a good way to think of it. It's like it's a safety zone around you. Outside of people that you live with, you really want to maintain that 6 feet distance. It drastically cuts your chances down of catching this disease. And one last thing about masks. The reason that we're not wearing masks right now is because number one, we're outside, and number two, we're more than 6 feet apart from each other. So we have that safe zone, and this is the way you can tell. But if we were inside or if we were closer, we'd be wearing masks. So please remember, don't be afraid to wear your mask. It's very important to protect yourself, but more importantly, to protect other people.
Thank you so much, Dr. J. I really appreciate your time and your insight.